Okay, so this is almost rehab cases. The doctor already make the good incisor edge position in between the tooth, and then kind of a little bit about deep bite. So we just increase just a little bit. Okay, so here is a temporization for future post and core. Doctor will going to put it in there. So just like that. So we did with the wax up, just like kind of a post and core types with wax up, and then we fabricated the temporizations right after that here, which is I made a print with a scan and design the bleaching colors, so just like here. So doctor can put after post and core, so they finish the reline inside. All right, so here is the anterior, which is we just give it to the dentist regarding the shape and contour. And then 8 and 9 all the time we make the good, just like the incisal translucency, which is hardly get that one. It's not easy about the regarding translucency and enamel. This will be created, looks like the 20 years old people as much as possible. And then with the texture, right, make the good size of the tooth, and the lateral apply this like here. Okay, now canines, just like canine lateral size teeth to make the good shape and contour. Same thing here. So basically we made the good alignment from here, this, and then we make the good size of the tooth, so same size, and then here kind of root. Okay, we make the good long axis, same thing here, lateral and canine. Okay, so that's the concept of the tooth. And this is the layer, the upper, but the posterior we fabricated with a monolithic lisi press, which is wax up, and then we full contour, and then we're using the luster paste and finish them up just like that. Okay, and the other side of the tooth. Here's kind of little small implant type. Make the linger contour, and the finer premolar. Right. So this is a full mouth case except one tooth, and then finishes like this, just like lifelike restorations with the bleaching color. So that's why patient can get the. This is the fantastic aesthetics. We do not make the monolithic, which is ugly. It's one color painted, but this is a layer art, all layer inside, just a little bit, and then we create a surface texture and the final work. This is what we presented for the patients. And then now the lower teeth, same as the upper. We try to match it, and lateral, central, and lateral. See, like I said, this is a temporary, which is a print material. Canine, and then premolar. Okay, and also this one is canine. First premolar, and second premolar as well, right? So basically we made the SEMS articulator and then finish the top and bottom just like that. See, there's almost rehab cases, finish it, and the lifelike restorations. That's why I present for This is the top of the line cases. The occlusion is right. This, right? Good. Here. Beautiful. And here is the size of the tooth is lateral, just like jewel. This one's really better than diamond in the patient's mouth. Then we can share with them. So, like I said, basically, patient has the lot of tetracycline previously, and patient wants the bright teeth as much as possible. We did not make the white teeth just like that, just like white. And also we created all the size which is from the Dr. Tam, and then here's a one dentition, right? So we increased it's a kind of 1 millimeter, and then we retreated here, post and core doctor will going to do, and then doctors prep it, and also we fabricated from the baseline about the central, so all the time same as the other teeth. Okay, so you have to watch out all the time central from the tissue line the same together. Okay, so once you set up the tissue line, and then you can go to lobe direction. Okay, lobe direction you have to match it. And also this one depends on what they want. Square round type. Central you have to match the perfectly. Now then you can go to the lateral. Just slightly step down because lateral excursion, but I keep the golden proportion of the tooth, just like here. The lateral. Okay, so size-wise, same thing. So you can make the another lobe direction here. Then you can make this better illusion of the tooth. Same as here. Same as there. And also you can get the canine. Just it depends on the canine guidance. So you make like this. Here too. Same thing. So you have to make the lobe direction. So we call 3 dimension. So here's a lobe, right? Then we can check the old golden proportion. If I say 100%, this is a 60, 70 and 80%. It's a 50 to 60%. So now when you go to lower teeth, it's pretty much the same thing. Trying to match the midline as close as possible. But the lateral is more a little bit wider. Usually, patient has the lateral is more bigger. Same thing, you can make the canine here because so we can get the canine guidance. Here too. And then we created the robe direction, same thing. This is the main job, we have to finish it like this. So we can recreate it. This is the edge, right? So basically we increase compared to what patients has, so increase a little bit 1 millimeter like this, which is just like that. So that's why patient can get this compared to this, right? So this is finer. So like I draw, this is a little bit longer, great, vocal corridor. And then here's a temporary for occlusion contact, right? Size of the tooth between the facial and lingual as well. And then upper with maxillary like this. So when put together, and then the excellent aesthetics, then we feel free to send it out to doctor's office so they can get to maximize it. Highest, aesthetic as much as possible. All right, thanks for watching. Thanks for following all social media. And this is a great case. I would like to share a case today.
Subscribe to Luke Kahn's Patreon for private ongoing training for dental technicians, lab owners, and aspiring lab owners. as well as valuable education from a lab side perspective for dentists. For just $25 a month, you can train with Luke Kahng online via live videos, with live chat, Q&A sessions, and ongoing dialogue exclusively on Patreon. This offer is ideal for dental lab technicians, lab owners, aspiring lab owners, and dentists. Subscribe today